Good morning, good afternoon, and good evening, wherever you are in the world. Welcome to today's Talking Tech, and thank you for joining us. I'm Army veteran Dan Hunter, a communications specialist in the Office of Information and Technology, and your host of this series, Talking Tech. So, wherever you are in the world, take a seat, prop up your feet, enjoy today's discussion, and send out a tweet. This monthly series gives VA technology experts an opportunity to share what they're doing to serve our nation's veterans. They'll discuss best practices, strategies, and techniques designed to enhance the veteran experience. VA uses ones and zeros to help our nation's heroes. Like, share, and comment throughout the show. I have an interview to do, so let's go. Today, I have with us one of the technology experts in the Department of Veterans Affairs. Her name is Lauren Alexanderson. Lauren brings to us a wealth of knowledge and experience and an education, a hard earned education. Lauren achieved two master's degrees while working full time, and she is now a digital services expert leading many projects to make life easier for veterans. Lauren, could you talk to us about what you do for the department and how you serve our nation's veterans?
Sure. So I work in the Chief Technology Officer's office, and our task is to apply human-centered design, agile product management, and data-driven decision making to deliver better outcomes for veterans. We try to improve the speed at which veterans can get their benefits, make it easier for them to do more things in a self-service kind of way, and the bottom line for us is that we make sure that everything we build, we're designing with those veterans and not for those veterans.
Well, thank you. That's a lot. Now, could you tell us about your team and how your team supports the department? Why you have a large portfolio? Could you talk to us a little bit about that?
Sure. So the CTO's office is organized into basically four portfolios. The first is called Digital Experience, and that is largely VA.gov and tools that veterans use to access and use their benefits online. We have a benefits portfolio, which is responsible for building some of the applications that veterans may use to manage and apply for their benefits, such as the GI Bill or their claims, but also does some work behind the scenes on trying to speed up this how quickly veterans can get those benefits, and making it easier for not just the veterans but also the staff who manage those benefits. We have a data team that is working on, data analytics, data quality, and improving the way ensuring that our staff that use data to make better decisions for veterans have the right data at the right time, and in the right format to be able to make those decisions. My team is focused on healthcare. And what we do is we work on both the veteran facing side and on the staff and clinician facing side to try to deliver better healthcare applications from a human centered perspective. And again, with that data lens. So, are we making sure that our clinicians, our staff, have the access to the right data that they need to make better decisions for veterans?
Awesome, awesome. Now, with that said, how do you work with the department's leadership to help you drive what you do in your world with the digital part of it to help the what I would call the operational folks? How do you do that? How do you work with those leaders and get the critical information you need to help them?
Yeah, our leaders are great partners, right? We, especially during the pandemic, we had the chance to work with a lot of the agency's leadership and we all came together on this vision of these are unprecedented times. We want to make sure that we are still meeting veterans where they are, and now where they are is at home, potentially, in a very different situation, but still make sure that they know how to get their benefits, what they need to do to get their benefits, what's changing about how they're getting their benefits. We work pretty closely with VBA, VHA, OIT, and NCA leadership, as well as OPIA, to make sure that we are, you know, defining the problem that we're trying to solve, that we are scoping those and incorporating veteran feedback along the way, and that we are delivering products in a way that meets veterans' needs.
Yeah. With that said, we have a large organization, the Department of Veterans Affairs. You mentioned VBA, which is the benefits. You mentioned the VHA, which is the health side. You mentioned the OPIA, which is the Office of Public and Intergovernmental Affairs. And we have a large organization. So you have to work with all the partners to help us as VA achieve the mission. Now, last year, March, pandemic hit. Uh, how did you work with the department leadership, and what things were you able to accomplish working with the leadership to help our veterans through this pandemic as we're still proceeding to fight through this pandemic?
Absolutely. So in March, the senior VHA and VEO and VBA leadership said, wow, we really need to do something. So they created what became the COVID Joint Task Force. And that was made up of people across the department. So we had a clinical facing lead, we had media relations, we had staff relations, sort of, you name it, anything that any audience you could think of that needed to be cared for. My role was to lead veteran facing communications. And what we did throughout the last 21 months, basically, we started with just what is the content that veterans need to know? Can we make sure that we are answering the questions that they have in a plain language format, something that is really easy to access, and then make sure that we take a copy once, publish everywhere model. We wanted to make sure that that content was consistent, was messaged consistently, was spread consistently. So while we had a page on va.gov, we also built a chat bot to help support our overwhelmed contact centers. We helped ensure that those messages were shared out through the different public affairs officers and My Healthy Vet coordinators and different teams. We use newsletters, we use text messages, we use social media. We kind of ran the gamut to make sure that we had everything covered and we were really answering questions. We also really closely monitoring veteran feedback. So as I mentioned at the start of our time, we do a lot of user research with veterans. We also really closely monitor that data. So we were looking at contact center scripts, at feedback coming in from veterans in different user research sessions. We were listening to them in, if they were commenting on social media, what were the trends there, so that we could understand what were their hot issues. That led us to create a number of different types of products. So one of the issues that popped up, we learned about, was the wait to get into a facility. Now all of a sudden everyone had to be screened, you had to answer all the questions, and so we developed a product that enabled staff and contractors as well as veterans and their family members to be able to quickly answer those questions on a phone and hold up that phone and say, I've passed, and either be redirected for additional COVID screening or be led into the facility. And that was came out of a partnership with the VA Medical Center in North Carolina in Durham. They had a great idea that we worked together to build and scale. And that product was used about 19 million times in the past year. And in some of the facilities, reduced a 45-minute line to zero, which was great. We also worked when the vaccine came out. So that we needed to be able to test that vaccine, and we wanted veterans to be included in that testing. They wanted them to feel a part of testing the vaccine. So we built a tool so veterans who are interested in signing up to participate in COVID vaccine tests could do so. And then last December, when the vaccine started coming out, we knew early on that our demand was going to outpace our supply. And we wanted to make it as easy as possible for veterans to let us know, I'm interested. Count me in. I want my vaccine. So that we could pass that information along to the VA medical centers. They knew who to, who is ready to go, who is ready to get that shot in their arm, and be able to work through their list and the priority list that they were sent from FDA and CDC, and get as many shots in arms as quickly as possible. And we adapted that tool over time when the Save Lives Act came out, and all of a sudden VA was eligible to vaccinate tons more people, spouses and caregivers and veterans who had never received care at the VA before, enabling them to sign up online so that when they showed up at the VA medical center, their stuff was already there. And I think one of the other things that I was really excited about, and it's one of the things I'll be proud of for many years, is that we use text messaging as a way to help veterans get their vaccines. So our goal was to not mimic what was going on in a lot of parts of the country. I know my parents were waiting forever to try to get a vaccine, and they were trying every place and getting online and trying to figure out how to get a vaccine. We were trying to take the perspective of, we're not going to make you come to us, we're going to come to you, we're going to tell you when it's your turn. And so we used our tool vet text, which different facilities could use in different ways. Some just decided to use it in a one-way capacity. Hey, we're doing a vaccine clinic on this date and time and you're invited. Or we also used it in a two-way vaccination pathway where you could actually book your vaccine appointment right on the phone. So you're eligible to get a vaccine. Here's the window. What day and time would you like to come in? And people would get their vaccine appointment right on their phone. And Jake Tapper tweeted about this a couple months into the process, and he was saying he was hearing all these great stories from veterans who found it really easy to get their COVID vaccine. And so when I was thinking about that as compared to just the pain my parents were going through trying to
Right.
get their own, it made me feel really good that we were actually serving veterans and making it as easy as possible for them to get their vaccines.
Wow. On the cutting edge, doing some creative things to serve our nation's veterans. And recapping, you listened to the veteran, you did your research, you worked with the leadership, found out what the needs were, you did your planning and figured out how to make that work. You were able to implement. You're able to constantly evaluate and then tweak things along the way to make things better to get the results that you are achieving. So outstanding, and keep up the work. The veterans have greatly supported and greatly appreciate what you're doing for all of the veterans out there needing these services and from the Department of Veterans Affairs. Awesome. Now you also mentioned that okay, we talked about your education a little bit, and let's talk a little bit about the work experience for people supporting you or working with you in digital services in the office of the chief technology officer and in the office of information and technology. You think about scientists and people have a way of doing things, but you have a way of using your creativity to help the department ultimately help our veterans. Can you talk a little bit about how you are able and your team is able to use your creativity to serve the department?
Sure. And I would say it really comes down to listening. So we have on our team product managers, we have human centered design researchers, we have visual designers, we have accessibility specialists, we have engineers and data scientists. We have a sort of a different kind of group of people who have a lot of expertise in the private sector or in nonprofits. I come from public health myself. And this is we really do our work by listening to veterans. And so I think the creativity comes from, iteration. So really agile product development. We do something, we test with users, we make changes to it. But it's really the veterans who are telling us what they need and want, or the staff in the case where we're building clinical facing applications or staff facing applications. They're telling us what problems they're trying to solve, where their pain points are, what's going well. And our job is to listen. Our job is to then take that information and put that into practice and try to make the application a little bit better, a little bit at a time. We believe really strongly in, testing iteratively on every single thing we build and knowing for sure that we have created a product that will work and that is not introducing more pain or challenges for our veterans or for our staff.
Awesome. You talked about what you did through the pandemic, going back to last March. You talked about some of the accomplishments recently. Can you talk about things that you're looking at right now and what you have in the pipeline to help our veterans in the future?
Sure thing. A couple things in our pipeline. So, one, we're working in a partnership with the Office of Veterans Access to Care on a modernized check in approach. And this is a relatively new effort. But if you have been to any doctor's appointment in the private sector in the last couple months, you may have used your mobile phone to complete some of that pre-check-in information. So you no longer have to complete all those forms while you're waiting at the doctor. So we are working on bringing that to our VA medical centers next year. We're also working with our clinicians on building out a clinical decision support platform and clinical decision facing applications that really take veteran data and put it right into the workflow. We design these with doctors so that we're marrying the clinical guidance. For example, in this case of our COVID patient manager application, we're taking the clinical guidance for when someone should be admitted, some presenting to the emergency room with COVID symptoms based on their medical history. Should they be admitted? Should they be sent home? How do we make that determination? So we've been working with a number of facilities on that application and some others. And I think the other sort of really big area that we're starting to work on is bringing sort of, if va.gov is meant to be veterans kind of front door, that is the place where they should be able to access all of their health and benefits in one place. They don't need to go to a lot of different places. We're trying to bring as many of those different applications into va.gov to design them intentionally with veterans in a very accessible format. And I know that you've had my colleague on here before. Accessibility is so important, particularly for the veteran audience. We think sometimes about accessibility in terms of a veteran who has low sight or limited vision, and that is important. It is also just as important to be thinking about a veteran with a traumatic brain injury, someone who may struggle to read a lot of text or have certain flashing images. So we try to take a very inclusive approach
Mm.
to building all of our applications. And our goals for the next year are really to sort of infuse that accessibility approach throughout everything that we're doing. And I think the last thing is, in we're working with the partner Office of Health Innovation and Learning on some new initiatives, really trying to, improve our digital health platform, data analytics, and other kinds of things. Just, making it easier for veterans to use their data as part of their conversation with their doctors and patients. So really excited about the direction we're going. And of course, we're continuing to iterate on products such as our online scheduling tool that right now enables veterans to self-schedule primary care, mental health appointments, as well as a few other subspecialties. If they're eligible for community care, they're able to request those community care appointments for certain types of care as well. So we're excited to be able to hopefully scale that one up as well, offering, potentially direct scheduling for telehealth appointments, and expanding kind of the different types of appointments that someone could make online and try to make that process easier and faster and far less painful than getting on the phone and waiting.
Wow. Hey, Lauren, digital services expert. I thought about your portfolio at first, and I thought it was pretty narrow. But wow, what what a large scope of responsibility that you have. So, as a veteran, I greatly appreciate what you're doing, and I know the other veterans out there greatly appreciate what you're doing to serve the community. Now, Looking 3 to 5 years from now, where do you see your office, and what do you see your office doing, and how do you see things getting carried out for veterans?
I hope our office becomes one of the best places to work in the federal government is my hope. I think we are really trying to do do cutting edge things in the lens of, working with our users. So my hope is in 3 to 5 years that everyone is coming to us with problems that they want to solve in a human-centered design way. I think we are, I think we're looking at tackling different types of problems in healthcare. I hope we will, be expanding our work in clinical decision support. I'm hoping that when veterans come to schedule online, that they can get that appointment in, minutes, that there's no wait on getting any kind of an appointment, that you can just get that thing taken care of right away. And that veterans really never need to know how the department is organized in order to figure out how to access and use their health and benefits. I think one of the other things that we're excited about and working on in our office is trying to improve the sign-on process. We know that is really kind of challenging for everyone, and we feel the pain, and we're trying to make that better too. Making sure that people have credentials that are secure and meet the modern security standards, but also are accessible, and that people can easily sign in, use, potentially mobile phones using biometrics, etc.
Nation's veterans, please contact our IT vendor management office at itvmo at va.gov. That's itvmo at va.gov. I think we're reconnected. Like, share, or comment throughout the show. Send a tweet, share that information with the audience, and get more people to join us. So we were talking about the future. We talked about the past. We talked about where you were with your education. We talked about the past and how things developed. We talked about the pandemic and how things have evolved, and how you worked with the other parts of the department to help veterans continue to get services, to improve their services, to keep and stay safe while getting an appointment, while going through the process at any medical center. And we talked about where you see yourself within the next year or so. And also, you looked into the future, and you looked about 3 to 5 years into the future, into that crystal ball, and what you see yourself doing, your office doing, and how you're going to be serving veterans. So, with all of that said, how could you use your lessons learned and share those with other departments and agencies on providing either healthcare service or customer service? What lessons learned can you share with the rest of the government?
Sure. I think the lessons learned that we have is that it is surprisingly not that hard, nor does it take that long to make sure that you're getting feedback from the people who will ultimately use the product that you're going to be releasing, or the thing that you're trying to build. So it's so incredibly important to take that step. It is so incredibly important to make sure throughout the process, starting from the very beginning, are we solving the right problem? You know, we people come, I think a lot of times it's really easy in today's technology to envision a solution, right? But that may be a solution that someone envisions for themselves, but it may not be a solution that will necessarily work for everybody. So making sure that you're solving a problem that matters to the end users, and that making sure that as you're working on solving that problem, that you have the right partners along the way to help support you. We are incredibly grateful for our partnerships across VHA who we work with. They, they're the ones, they're our clinicians and nurses are the ones on the ground, really living the experience of delivering better healthcare to veterans, and our job is to support them. Um, our job is also to make sure that veterans and caregivers are met where they are. So how can we be thinking across their world, right? So VA is organized into, different groups, and I think it's really easy to be thinking about just education or just healthcare or just, memorials, any part of the world that you focus on. But for a veteran, life healthcare starts at the kitchen table, right? They're managing all of their appointments, and maybe they're going to a football game, if their kid's football game in the afternoon and they have that VA appointment in the morning, and they're managing all of that on the same calendar. So how can we be thinking and breaking the mold and thinking about the common problems that we're solving across the agency? So that is something I've learned a lot about, is that a lot of the problems are quite similar. Actually, when you think about health and benefits, people have appointments that they need to go, they need to authenticate and log into things, they're communicating in some form or fashion, whether that be through secure messages or chat or phone calls or any means of, all different means. They need help, they have questions sometimes, right? So how can we be applying lessons learned across these different common sets of problems, uh, where we don't have to reinvent the wheel over and over and over again, but we can say, hey, we did this thing in healthcare, how can we apply it to benefits too? Or hey, we did the thing in benefits, how can we apply it to delivering, better health services? And really try to think outside of our program offices, outside of our particular roles, and think kind of as laterally as possible to solve problems in a common way that makes it, the patterns recognizable and as easy as possible for veterans to use and us to scale.
Right. And I heard something that you said, and this goes back to the first question I asked you, and you mentioned listening and how listening is so important, and not just going through the act of listening, but really taking the time to understand what someone really needs, and then being able to act upon their needs to help them. So no, greatly appreciate it. Lauren, we could talk all day. I know that you have other meetings lined up, but we greatly appreciate what you do here at the Department of Veterans Affairs. As a veteran, I greatly appreciate what you do and what your team does, and what you're going to be doing in the future. We thank you so much. And for those in the audience, just want to let you know that if you have a service or application that you want to share with the department and it's IT related, don't hesitate to contact our IT vendor management office, and that's itvmo@va.gov. Lauren, thank you so much for participating with us. And for the audience, join us next month for Talking Tech, where we talk about how we use ones and zeros to help our nation's heroes.